Hi, welcome to Nursing Manthra NCLEX series. Today we will discuss regarding psychiatric related topic, that is anxiety disorder. Now we can see what is the types of anxiety disorders. GAD, generalized anxiety disorder. SAD, SAD, social anxiety disorder. Panic disorder and suppression anxiety. Then there will be phobias will be there. That also comes under anxiety. In phobias, OCD, obsessive compulsory disorder, PTSD, post-traumatic stress disorder will be there. So we can see the pathophysiology of anxiety. So during severe anxiety, the mind goes into a stage of panic, and so the body goes into fight or flight mode, turning on the sympathetic nervous system, SNS. So the SNS tells the body to shunt blood flow away from the extremities and towards the core of the body for the vital organs and to increase the vital signs. So what is the memory trick here means? SNS means a sympathetic nervous system means it will speed up the vital signs. That means increasing your heart rate, increasing the blood pressure, sugar levels and dilating the pupils all will be there when you are getting anxiety. Sympathetic nervous system speed up the vital signs, all the vital signs. So now we can see what are the characteristics of anxiety. Anxiety is a normal response to a stress. Client experience feeling of uneasiness, uncertainty or sometimes dread also. Occurs as a result of a threat that may be misperceived or misinterpreted or of a threat to identify or self-esteem and all. Now we can see the classification of anxiety. Normal anxiety, that is a healthy type of anxiety, it will not create a problem. Acute anxiety, that means precipitated by imminent loss or change that threatens one's sense of security. Chronic anxiety means anxiety that persists as a characteristic response to the daily activities. It will involve in the daily activities. That is chronic anxiety. So now we can see the levels of anxiety. Mild anxiety is associated with the tension of everyday life. The individual will be alert. The perceptual field is increased. Mild anxiety can be motivating to produce the growth, enhance the creativity and increase the learning in the mild anxiety. Now we can see the second level, that is moderate anxiety. The focus is on immediate concern. Moderate anxiety narrows the perceptual field. Selective inattentiveness occurs here. Learning and problem solving still occur in moderate anxiety. Introducing the all new Nursing Manthra NCLEX series, which contains study materials and video crash course, specifically designed for easy access and most convenient method of study. The series has been divided into 5 main parts. Question bank, rationale followed by each question, the explanatory video collections with the help of illustrations and animations, exam handbook, and finally we have the mock test and cheat sheets. Select your package now and get started. For more information about the subscription plans, you can contact Nursing Manthra WhatsApp